Well, I'm so thankful for the experiences that I've had with cannabis and seeing the impact that patients have had in so many aspects of their health. It's a way to reconnect with themselves and reconnect with the planet. It's an herb that grows from the earth that we've been using for millennia, and now we're rediscovering. And the stigma is starting to wash away, although there's still so much. There's still so many physicians that just don't understand and still have that stigma that this is a bad, it's a gateway drug. Where I've seen just the amazing potential of this plant and seen how it can change people's lives and get them off opiates. Getting them out of the house, being able to interact with people again, people who have not left their house in years because of anxiety, people whose chronic pain has become manageable again. It's given people their lives back, and I just am so thankful that I've been blessed to have been exposed to it and have been able to help people change their lives. Alternatives. And when I heard about some of the success stories that people are having with cannabis, it just made me want to research it more and find out how it can help people get them off these deadly drugs. I've had patients overdose, and it's terrible. It's terrible, and they're just trying to feel better, but it's not the best way to do it. And cannabis doesn't work for everybody, and it doesn't eliminate pain, but it can certainly make your life more manageable. And I think that is something that I'm all for. And if it's something natural, I'm also a huge advocate for natural medicine. Obviously, I practice functional medicine, which is a holistic approach, trying to get people off of medications, trying to use diet, exercise, mind body practices, meditation, tai chi, yoga, all those things. And cannabis is one of the tools that I use quite frequently to help people. But I use a lot of other herbs and supplements as well. I like to talk about what the qualifying condition they have and why they would want to use or think they would benefit from medical cannabis. So in this case, this man has chronic abdominal pain due to cirrhosis and ascites. So he told me a little bit about that. I like to go into when they were diagnosed and what other chronic medical conditions they have to see how cannabis will affect any of those. I also like to talk about what their current medications are, as well as what supplements they're on, and what else they've tried to manage the chronic condition that they're seeking medical cannabis for. It's really important to know all of the different things that they've tried because if cannabis is not the right fit for them, we want to make sure they are trying to get help in other ways. Also like to go through their medications because there are quite a few potential drug interactions. So really knowing what drugs they're on and how cannabis may impact them and how they may impact cannabis, because many drugs you need to start even slower because the decreased metabolism of cannabis can be affected by other drugs. So what medications are you currently taking? So I asked this to the patient. He's currently taking Zoloft, gabapentin, and furosemide. So cannabis can can be affected by Zoloft, and so we in a way that increases levels of cannabinoids. So people may need smaller doses of cannabis when on a medication like Zoloft. In those cases, we want to really emphasize the importance of starting low and going slow to make sure that they don't have any negative side effects of the cannabis. I'd always like to talk about family history, one, to assess their risk for chronic diseases like cancer and diabetes and heart disease, but especially for mental health. Any history of suicidal thoughts in the family or successful suicides in the family. Also, any family history of psychotic disorders like bipolar with psychotic features or schizophrenia. These patients, we have to be especially careful with using cannabis because of the potential for triggering psychotic episodes or increasing their chronic or increasing episodes of psychotic hospitalizations, which may be affected by cannabis. Lives in. when I heard about some of the success stories that people were having with cannabis, it just made me want to research it more and find out how it can help people get them off these deadly drugs. You know, I've had patients overdose, and it's terrible. It's terrible, and they're just trying to feel better, but it's not the best way to do it. And cannabis doesn't work for everybody, and it doesn't eliminate pain, but it can certainly make your life more manageable. And I think that is something that I'm all for. And if it's something natural, I'm also a huge advocate for natural medicine. Obviously, I practice functional medicine, which is a holistic approach, trying to get people off of medications, trying to use diet, exercise, mind body practices, meditation, tai chi, yoga, all those things. And cannabis is one of the tools that I use quite frequently to help people. But I use a lot of other herbs and supplements. I'm Dr. Scott Jacobson. Nice to meet you. Ruben, great. So is this your first time getting a card?
No, it's not.
Okay. How long have you been using cannabis for?
I've been using cannabis for about 20 years now.
Okay. Well, and what do you find it's helpful for?
Um, I have extreme anxiety
Uh-huh.
and panic attacks,
Uh-huh.
and originally, that's what drove me to cannabis,
Uh-huh.
having the panic attacks and all that, and
Yeah.
it gave me instant relief.
Mm-hmm.
Now that I'm older, I have other little ailments,
Okay.
back pain,
Mm-hmm.
anxiety's still bad,
Uh-huh.
I have kidney stones that are pretty bad that are causing some of the back pain too.
Uh-huh.
Yeah.
And so when did you first start struggling with anxiety?
I would say my first panic attack, I was 19.
Oh,
That was the first time I really realized something else.
mm-hmm. And what have you tried for it in the past? I mean, have you been on antidepressants or benzodiazepines? Or...
No. Actually, no, that's not true. I did Prozac
Mm-hmm.
initially.
And have you seen a therapist?
I was seeing therapists.
Uh-huh.
I've seen therapists through the years.
Mm-hmm. Okay. And when did you start using cannabis?
I was about 19.
Okay.
It was my second panic attack, I think.
Mm-hmm. And any depression?
Yes.
And any thoughts of hurting yourself at all?
I have suicidal ideations.
Uh-huh.
Yeah.
And do you find that cannabis helps with that?
Definitely.
Yeah.
Definitely.
Okay, terrific.
It helps me focus on something else.
What kind of symptoms besides the knee and back pain? Do you have nightmares, flashbacks, like those types of things?
I know, actually, smells, certain smells, personal smells, set things off for me.
Yeah. And did that cause like panic attacks or anxiety?
Anxiety, panic attacks. I have to realize I'm in the now, in the present.
Yeah. Have you ever had any surgeries?
I've had a hysterectomy in
Mhm.
2010.
Mm-hmm.
I had stage 3 endometriosis.
Oh, wow.
And then I had a tummy tuck and a breast reduction shortly after.
Okay.
I had a new lease on life.
Mhm.
I thought I was going to live this better.
Any allergies to any medicines?
None whatsoever.
No. And you said your mom has heart disease. Otherwise, your family is pretty good health.
Yes.
Terrific. Do you drink any alcohol?
Occasionally, when the occasion calls for it, but I'm not a daily drinker. No,
Okay.
not by any measure.
And were you a smoker ever?
I did smoke while I was in the military for 7 years. I smoked half a pack of cigarettes a day.
And when you use cannabis, how do you like to use it?
I dab
Uh-huh.
because I used to smoke a lot of cannabis, but the smoking
Uh-huh.
it causes a lot of coughing, and so
Sure.
the dabbing is cleaner. It's more potent. It
Yeah.
lasts longer. I don't have to dab so much.
Got it.
I also do edibles, and I make cannabis butter. I
Oh,
make
you
cannabis
do?
butter for my father too.
Oh, that's terrific.
He puts it on his crackers or
Yeah.
toast.
Oh, that's great. So have you cultivated it before?
No, I don't
No.
grow. I can't even grow a house plant. No, I don't grow. I just want the discounts because it's so
Sure.
expensive, and
Yeah.
insurance doesn't,
Yeah.
reimburse me at all.
Yeah. And how long have you been struggling with these things? I mean, the back pain, knee pain, is that?
I got out of the military in 1999,
Uh-huh.
and I started having knee pain probably a year afterwards.
Yeah.
Year in knee pain and lower back pain.
Got
I used to be a boatswain mate, so we did a lot of lifting, carrying things upstairs,
Okay.
down ladder wells, stuff like that. And I was a large female, so I was trying to pull my weight.
Okay. How do you feel cannabis has helped you?
When I was just on psych meds, my
Mhm.
days were gray.
Yeah.
It was always gray. I don't care how blue it was outside, but medical marijuana turned everything blue again. I have blue skies,
Yeah.
and life is pretty again.
Oh, terrific. Okay, great. So we can certainly go ahead and get you, your card again. I think you
I'd love to.
definitely qualify, and I'm so glad that you've had some success with it in the past. You've been able to get off some of these so damaging medicines like the opiates. So
Yes.
that's terrific. And do you have any questions for me?
Well, no, not really. I mean, I just, I go to the dispensaries and I don't see like cannabis suppositories or capsules, or they don't even make cannabis butter for patients.
Yeah.
And it's like the easiest thing to make, but it's expensive,
It is, yeah.
But I just want to ingest it more. Any ideas on how to ingest cannabis more? If
Well,
you're not a
definitely.
grower.
Yeah, well, definitely making your own is definitely the most cost effective. I've had patients make their own suppositories, and if you're crafty and like doing that kind of stuff, it's actually not that difficult. Like you said, making the oil is fine, is not bad. Once you have the oil, you can make them into you can buy kits that are molds, and then you can buy like shea butter and other things that kind of help. And you can
Yes.
freeze them and use them as suppository. So I've had some great success with people doing that. And then tinctures, making your own, whether you just make the butter or coconut oil, and you can just eat that directly, or you can put it into capsules, is another way to ingest, or
Yes.
making like an RSO or your own concentrate. It's also not that hard to do, which, depending on the potency of the flower you get, sometimes a little easier than making the butter or oil. And you can get it even more concentrated.
Yeah, I'm gaining weight. I
Yeah.
make a lot of edibles.
I know.
So I need to switch to capsules. My weight's going
Yeah.
up a little bit.
Yeah, so just
Good,
taking,
I'll
you
try
can do
that.
the butter, or just I prefer coconut oil.
Coconut oil.
yeah.
Okay. Yeah.
It's just making the same way you would make the butter, make it with coconut oil, and then you can put that into capsules.
Oh, okay. Thank you.
yeah.
I will try that. Thank
Yeah.
you. Thank you.
It's a little easier on the stomach than butter. You
Yeah,
need
I know
like a
eating a
tablespoon of butter. But also coconut oil is high calorie as well. And that's where making the RSO might be another option for you, because that
Okay.
way you're doing an extraction with just, you can use grain alcohol, and you just soak the cannabis, activate the cannabis first, so you
Yeah.
have to heat it. And there's a number of ways you could do that, and then
I just did it in my oven.
yeah, that's what lots of people do. Low setting, like 200, 210 for an hour or so. That activates it. Then you can just soak it in alcohol, and then basically leave it in the container open and allow the alcohol to evaporate. And then
Okay.
it just, once all the alcohol evaporates, you're just left with the. Well, actually, you have to strain it first before letting it
oil.
evaporate. Yeah. And then you're just left with the oil, and then you can capsule that oil. You can just take it with a dropper.